Yoga in oncologic care, an evidence-based treatment to improve outcomes. This was printed in ASCO Post, written by Lorenzo Cohen, PhD, and Santoshi Narayan, MD, April 10th, 2021. The ASCO's Post-Integrative Oncology series is intended to facilitate the availability of evidence-based information on integrative and complementary therapies, sometimes used by patients with cancer. Increasingly, patients with cancer have non-pharmacological strategies for managing their symptoms. Yoga is a time-honored mind-body practice that has been shown to improve both physical and psychological well-being. In this article, Lorenzo Cohen and Santoshi Narayan summarize the current evidence surrounding the use of yoga in oncology settings and highlight the need for increased efforts to make yoga available to more patients with cancer. Overview. Patients often want a more comprehensive approach to their cancer care, seeking non-pharmacologic treatments to improve symptom management or clinical outcomes and mortality. An integrative approach involves addressing the physical, psychospiritual, and social needs alongside the biomedical aspects. Mind-body treatments such as meditation, yoga, tai chi, qigong, and music therapy, to name a few, are commonly used by patients and also recommended by clinicians due to their overall safety and efficacy. Yoga is one such therapy that can address physical and psychological needs and promote well-being. It is a movement-based mind-body practice that focuses on synchronizing body, breath, and mind. Originating from India, it's now practiced worldwide to improve and maintain health. Data from the National Health Interview Survey suggests significant increases in the practice of yoga and meditation in the United States, with the use of yoga increasing from 9.5% to 14.3%, and meditation from 4.1% to 14.2% between 2012 and 2017. Nowhere is the use of yoga more prevalent than in people undergoing cancer treatment and in cancer survivors, as more and more hospitals and cancer centers offer this important treatment modality. Interest in the field of yoga and its expansion are due in part to the robust evidence base, showing that yoga improves multiple aspects of quality of life, physiologic outcomes, and biologic processes, as well as the increased understanding of the harms of chronic stress on cancer outcomes. Stress and cancer. Chronic stress activates the sympathetic nervous system and multiple biologic processes, making our bodies more hospitable to cancer growth. Evidence shows that depression, independent of disease severity, is associated with increased mortality. Stress also negatively impacts the quality of life. It disrupts healthy sleep patterns, with sleep disturbance among the most commonly reported symptoms in patients with advanced cancer. Sleep improvement can cause worsening of memory, contribute to fatigue and daytime drowsiness, and result in negative biologic changes, including increased inflammation, decreased cell-mediated immunity, and alterations in energy metabolism. Chronic stress also disrupts other health behaviors, including healthy eating patterns and motivation to exercise. It is understandable and expected that patients and their spouses, caregivers, would experience chronic stress at some time during the cancer care continuum. Even though the experience of chronic stress should be normalized, It's crucial for patients with cancer to manage stress in their lives to help improve their quality of life and clinical outcomes. Extensive literature now exists to support the use of mind-body practices, including guided imagery, relaxation, hypnosis, biofeedback, meditation, yoga, tai chi, and qigong, as well as expressive arts, example, music therapy, to help reduce chronic stress. These modalities may help to decrease the biologic perpetuations associated with chronic stress and may improve both the physical and mental health aspects before, during, and after treatment. Yoga as a treatment approach. The evidence. Extensive research now supports yoga's benefits in improving overall health, quality of life, and physical function, as well as reducing distress, anxiety, depression, sleep disturbance, and fatigue. A review of 29 clinical trials showed that low-intensity forms of yoga, specifically gentle hatha and restorative yoga, are safe and effective for relieving sleep disruption, nausea, fatigue, pain, psychosocial distress, and musculoskeletal symptoms, and also may have a positive effect on cognitive impairment. In a multi-center randomized trial involving cancer survivors with sleep disturbance, a combination hatha restorative yoga intervention was found to improve sleep quality. Research also shows that yoga benefits can translate into improved physiologic functioning, including better stress hormone regulation and enhanced immune function. Finally, caregivers may experience distress, and studies indicate that yoga helps their spiritual well-being, along with improving fatigue, sleep, anxiety, and depression in couple-based yoga programs. According to the Joint Society of Integrative Oncology and ASCO guidelines for the use of integrative therapies during and after breast cancer treatment, yoga is recommended for reducing anxiety as well as improving quality of life, mood, depressive symptoms, fatigue, and sleep. Similarly, the National Comprehensive Cancer Network recommends patients consider yoga for improving some survivorship areas such as distress, cognitive functioning, menopausal symptoms, and pain. Yoga is also formally listed in the NCCN Clinical Practice Guidelines in Oncology as an effective intervention for cancer-related fatigue and anticipatory nausea, vomiting. Recommendations and future directions. Given the strong evidence to support yoga as an adjunct modality in managing cancer-related symptoms, it is incumbent on medical systems to offer this evidence-based treatment. Ideally, yoga instruction in an oncology setting is delivered by yoga therapists, instructors who have additional training to work with medical populations and oncology experience. At the University of Texas Anderson Cancer Center, yoga and other mind-body practices are offered in a group delivery setting for our patients and their caregivers, as well as in one-on-one setting. Due to the expansion of telemedicine during and after the COVID-19 pandemic, our center and others are offering these sessions remotely via video. Yoga has an excellent safety profile, but modifications may be needed in patients with post-operative restrictions or spinal bone metastatic disease. Despite an increasing evidence base and being listed on multiple symptom control care pathways and guidelines, many patients with cancer may be unaware of yoga therapy's benefits. Therefore, greater dissemination and implementation efforts are needed to make yoga available to the broader community of individuals impacted by cancer. With the vast array of yoga meditation practices to choose from, the ideal program is one that patients are willing to do regularly to create calm in their lives.